The video provides an overview of hypersomnia and hypersomnolence, which are medical conditions that cause excessive daytime sleepiness. Hypersomnia is characterized by excessive sleepiness when wakefulness is expected and may be caused by breathing disorders, neurological conditions, and certain medications. Hypersomnolence is a medical condition characterized by hypersomnia due to a problem with the brain's ability to regulate the sleep rhythm. The article provides symptoms, causes, and diagnostic methods for hypersomnia and hypersomnolence, as well as other similar medical conditions that may cause excessive daytime sleepiness. The treatment depends on the root cause and may include modifying sleeping habits, managing medical issues, and taking prescription medication. It's important to speak with a healthcare provider if you experience symptoms of hypersomnia or hypersomnolence. Understanding hypersomnia. Excessive sleepiness and its causes. Experiencing drowsiness and fatigue from time to time is normal, especially when you haven't had enough sleep. This is known as hypersomnia or hypersomnolence. In some cases, the drowsiness can be severe and persistent, and taking naps may not provide relief. This could be a sign of another sleep disorder, a condition called idiopathic hypersomnia, or it may be caused by side effects of medications. It's important to understand how hypersomnia affects your health, its causes, and how it can be managed. Symptoms of hypersomnia. Hypersomnia is defined by excessive sleepiness or sleeping for more than 10 hours at night. Typical symptoms include difficulty waking up, confusion and disorientation upon waking, a strong desire to nap throughout the day, anxiety, restlessness, loss of energy, memory and speech problems, cloudy thinking, loss of appetite, and even hallucinations. These symptoms can make it challenging for people with hypersomnia to stay awake at work or school and can significantly impact their professional and personal lives. Types of hypersomnia. There are two main types of hypersomnia. 1. Primary hypersomnia. This type occurs independently of other health conditions and may be caused by sleep disorders such as narcolepsy, obstructive sleep apnea, Klein-11 syndrome, or as an idiopathic condition. 2. Secondary hypersomnia. This type is triggered by medications, certain diseases or health conditions like hypothyroidism, alcohol or drug use, or working overnight shifts. Causes of hypersomnia. There are several factors that can contribute to hypersomnia. The most common causes include insufficient sleep, sleep disorders like narcolepsy and sleep apnea, alcohol or drug use, and certain medications. Not getting enough sleep or having interrupted sleep is the most common cause of hypersomnia symptoms. Sleep disorders and neurological conditions like narcolepsy, sleep apnea, and idiopathic hypersomnia can also lead to excessive sleepiness. Additionally, the use of alcohol, drugs, and certain medications can result in daytime drowsiness and excessive sleep. Medications that can cause hypersomnia. Some prescribed and over-the-counter medications can also cause hypersomnia as a side effect. Examples include antihistamines, antidepressants, benzodiazepines, beta blockers, muscle relaxers, and opioids. It's important to be aware of the potential side effects of the medications you are taking and to consult your healthcare provider if you experience worsening symptoms or if the side effects interfere with your daily life. Diagnosing the cause of hypersomnia. If you are experiencing symptoms of hypersomnia, a healthcare provider will likely perform several tests to identify the underlying cause. This may involve assessing your medical history, conducting an electroencephalogram, EEG, to analyze brainwave activity, a polysomnogram to monitor sleep patterns, a multiple sleep latency test to evaluate how quickly you fall asleep, and clinical testing to check for underlying health conditions. In some cases, imaging techniques such as a CT scan may also be used to investigate potential neurological causes. Treating hypersomnia. The treatment of hypersomnia depends on its underlying cause. Stimulant medications and wakefulness-promoting agents are often prescribed to manage idiopathic hypersomnia and sleep-related disorders. Other emerging therapies and sleep medications may also be used. If medications are causing hypersomnia, a change in prescription may be necessary. In cases where hypersomnia is associated with other sleep disorders, additional treatments such as cognitive behavioral therapy, phototherapy, continuous positive airway pressure, CPAP, therapy, and melatonin supplements may be beneficial. It's also important to make lifestyle changes to promote healthy sleep, such as avoiding alcohol, tobacco, and illicit drugs, maintaining a consistent sleep schedule, creating a relaxing bedtime routine, and getting regular exercise. When to seek healthcare providers' assistance. While hypersomnia itself is not life-threatening, it can significantly impact daily life and should be addressed if it consistently disrupts your sleep or daily activities, if it may be related to medication use, if it persists despite adequate sleep, or if it poses a safety risk, e.g., falling asleep while driving. Seeking medical assistance is recommended in such cases. In summary, hypersomnia is characterized by excessive sleepiness and can arise from various causes such as sleep disorders, inadequate sleep, drug, alcohol use, and certain medications. Proper diagnosis and targeted treatment, along with lifestyle modifications, can help manage the condition and improve quality of life. The FDA has approved Xywav, a drug made by Jazz Pharmaceuticals of Dublin, Ireland, to treat the rare sleep disorder idiopathic hypersomnia. This condition causes extreme sleepiness during the day, difficulty waking up, and confusion upon waking up, among other symptoms. Xywav is an oral mixture of gamma-hydroxybutyrate, GHB, and must be prescribed and dispensed through a risk evaluation and mitigation strategy (REMS) program due to its potential for abuse. Xywav will only be available by mail order from certified healthcare providers and pharmacies. The drug has the potential for physical or psychological dependence, so only certain certified healthcare professionals are allowed to prescribe it. The out-of-pocket cost for Xywav is approximately $100,000 a year, but assistance programs are available.